Okay, greetings everyone. This is First Centaurian 753 with a new game, Covid-19, the Outbreak. This is sort of like a pandemic containment type game. If you guys are familiar with the board game Pandemic, I've been playing that a lot lately, ironically. And in this game, you are charged with leading the GHO, Global Health Organization, related to the WHO in real life, the World Health Organization, and your job is to contain a global pandemic. I don't know if it's necessarily COVID, but it is you're the Global Health Organization, and you have to manage the spread, or try to contain the spread of the disease, either through different decrees. You can also require countries or recommend countries conduct certain actions. You have a certain amount of influence with each country too, and your influence determines what actions you can actually get them to do. See, right now I don't have enough of the requirements, which are global. Actually, I do have the most global influence. That's at 48. You would need 10 for this action, but there also is a fear component too. So the population has to be has to have a certain amount of fear in order to convince the government, or to give the government the ability to conduct some of these actions. So you can encourage governments to take certain actions. You can manage different types of resources. You have medical supplies, which you can buy, give, sell. You have science points, which you can donate or buy or sell. And then there's also money, and you see the totals up here. You have your money, you have your medical supplies, and you have your science points. It has the world population here on this top panel, the number of people infected, the number of deaths, the number of people who are immune. And then, like I said, money, medical supplies, science points, the vaccination level, and the level of the virus, which I think affects the mortality rate. Starting at level 1, you're at 2.75. I think it goes up to I want to say 99. So yeah, we have the Global Health Organization here, which you are in charge of. You earn money weekly at this point, and there's a donation rate, which I don't know how that gets adjusted. But you can earn money weekly with $866 or whatever increment they're using there. Weekly medical supplies, weekly science points, and GHO influence. And then it tells you the virus, the world situation, all the stuff you see up top here, pretty much. You can also go into each country and analyze things per country, depending on what country you click on, or you're clicked on. It gives you the population, how many are infected, all the same statistics here. Each country does contribute, or has a certain number of medical supplies and science points, and then they also contribute a certain number of medical and financial contributions and science contributions. There are buildings that you can eventually construct. You'll be able to construct them in different countries. They'll cost money and influence. And some of them are medical labs, regional offices, headquarters. You're going to have to build a headquarters, diplomatic training center. You do have a certain number of units too, and units, volunteer centers, disinfectant manufacturing, field hospital. Lots of different buildings you can get into. Haven't gotten into this game too much yet. I just sort of purchased it yesterday, and I thought it looked pretty cool, so I wanted to see what people thought about this. Do you want me to play? Is this an option for my channel? As far as research and regulations, there are 2 categories under regulations, which is under disease control. Any means necessary, which you're going to have a whole sort of, not a tech tree really, but a policy tree, I guess. And then there's spread prevention. And again, this is similar to the impacts you're going to have on countries. Oh, and there's also support actions down there. I forgot to mention that. And you need a certain number of, there's a certain cost for each one of these money, medical supplies, science points. So we're going to cancel that. Then there's research. You do have to research the disease and testing facilities and herd immunity approach. That's interesting. Different treatments, as well as a vaccine itself. There's vaccine research here. And then there's research for your headquarters. Fundraising, PR department, staff training, etc. So there's lots of research there. Then there's global decrees. I think I looked at this before. Epidemic research, global pandemic resolution, martial law resolution, mandatory vaccine resolution, a lot of information campaign, a lot of different options there. And then there's your actual vaccine research, which you have to get involved in. And I have not really done a lot of this, so I don't know exactly what this entails, but it looks interesting. Simulation charts, I haven't used these at all either. I'm not 100% sure about them yet. And, oh yeah, here you have cooperation requests or provide tests. So you're going to have to manage the disease as it spreads from country to country. Over here we have the different map views, which are pretty cool. This is the regular view is the infectious spread view, and we don't have any diseases yet since I just started. The fear level. This is how much people in each country are afraid of the global pandemic, and as you see, since we haven't had the disease spread or news of the disease spread yet, no one's afraid of it. Ongoing GHO solutions, that's going to be different decrees that we recommend countries partake in. You can encourage countries to close air borders, sea borders, land borders, limit public gatherings, close schools, have order remote work orders, work from home, close public institutions, close private businesses. So I think it gets more severe as you go down the line to the right there. But those would all be in these countries once you decree them. And it moves kind of quickly, too, to be honest with you. So there might be a lot of pausing going on. All right, this is interesting because this has all the different connections. Global open transport connections. So if you look at Belarus here, there are 11 air connections and 5 ground connections. No sea connections because they're landlocked countries, but sea-based countries are going to have more. I'm curious about China. I think has a lot. Yeah, that's a good amount. No land connection for Japan because they're an island. United States, yeah, they might have the most. So if you go down further, this shows all the connections from the country that you're clicked on. So if I click on Germany, a lot more connections. Alright, United States, probably going to be insane. Yep. Those are some global connections. That's as far as you can do it. China. And there's that connection to the United States right there. Where is that? St. Louis? It's a weird spot to put the connection. I'd say New York. But other countries don't have as many connections. It's more regional. The Congo there. Botswana? Probably a lot less, yeah. Chad, yeah. Uganda. I wonder if these island countries have a lot of connections. It's all regional from New Guinea. New Zealand. Yeah, they should have a connection to the UK, I would think, too, right? Interesting. Anyways, so different connection views there. You can isolate it to specific types of connections. So all air transportation connections, sea transportation connections. They connect through the Caspian Sea there. Looks like Kazakhstan connects through to a number of countries in the Caspian. Land transport. So this is important, looking at these transport connections, to see what type of decree you're going to recommend. Countries that have a lot of air connections, you're going to want to close down the air borders. Sea borders, maybe, depends on the country again. So, stuff to consider. Money contributed, this is how much money each country contributes to the WHO, which is the Global Health Organization again. The United States has the most, I think. Oh no, China's got the most. 2,000. I didn't see the K of 2K. Wow. That's a lot. Medical supply contribution. Ooh, 12 from China. China's the leader here. Look at these European countries. No, not so much. Alright. Science points contribution. 12 from Russia. That's big. 40 from the United States. Holy cow. 15 from Brazil. Whoa! 121 from China. 76 from India. Wow. These are huge numbers. Huge numbers. Okay. From those countries. Medical supply usage. Population overview. Deaths. How many deaths there are. Virus immune population. No one is immune yet. No one's had the virus. Building overview range, that'll show you where your buildings are. And then units. You're going to have different units. I think there's a diplomat, security force, and some sort of operations specialists. So this looks like a really cool game to me, and I feel like people on my channel may like this game. If you do think that this would be a game you want to see me play, go ahead and hit the like button, or leave a comment down below. And I kind of want to get into this game a little bit. We should probably... we can play for a couple minutes maybe here. I would say right off the bat, you're not going to worry about... I think it's more important to... I have no idea. I played this like once yesterday. So, it moves really quickly. And the disease spread really quickly. So yeah, I think there's going to be a lot of pausing, at least right from the beginning. Global panic. So you want the panic to be up. You see, it's... I think you want it to be up. The higher the panic is, the easier it is for you to get things done. So that's what I gathered from what I played yesterday. Time is 15. Spread, prevention, procedures. Run standard spread, prevention procedures to decrease the amount of new infections. Sounds like something you want to do right off the bat, right? Let's confirm that. And that'll help get us access to these other options. Crisis management procedures. And that cost me $2,000, right? Yeah, so that's that. And that's something you got to consider. Medical supplies are limited to 10,000. That goes pretty quickly. So let's just, here we go. We already have spread, disease prevention procedures. I have that. Low medical supply income. Let's just press play and see how this goes. And it should tell you when there's an infection. There we go. Welcome to the WHO, boss. Alright, 1987, there have been approximately 5 billion people in the world. Today there are 7.6 billion. And by 2050, there will almost be 10 billion. A rapidly rising population had been accompanied by our dreaded desire for eternal conquest. Natural disasters, human impact on the environment, animal experiments, all have taken a tremendous toll on Mother Nature, who has had enough of our transgression. People are not yet aware of what a formidable opponent they will have to face, and that their lives will never be the same again. A new epidemic is just beginning. As Global Health Organization, your task is to contain the spread of the new coronavirus. So it is the coronavirus. And save humanity from the onslaught of invisible enemy. You will have all the necessary tools at your disposal, but you must act quickly and decisively. Keep in mind, with each passing day, more people are getting infected. The number of casualties will inevitably follow as well. Remain passive for too long, and you will have to face not only the relentless coronavirus, but the very people who put their trust in your guidance and expertise. Lead humanity through this crisis. The future of humankind is in your hands. So it begins. So let's just take a look at this. How do you want to do this? Okay, we have different modes. Easy, normal, or hard. I'm definitely going to go with easy to start here. And there you got your booyah, your beginning. Alright, looks like Botswana reports first infected case November 3rd. Yikes, so we got to deal with Botswana. Let's just take a look at Botswana real quick here. I think we can go to country info. There we go. 2 million people, 450 infected. Medical supplies are at 15, pretty low there. Science, not too much. No land borders, so we don't have to worry about that. The sea borders are... oh, no, the land border, we do have to worry about that. Virus spread chances, 65 through land border. 15 through air border. So right away you want to shut down the land border if possible there. That's not the only country that has it. Liberia reported a case. And here's one of our agents here, a diplomat. And the diplomat needs to move to Liberia, I think, so we can gain some influence there maybe. Maybe that'll be one way we can handle things. Let's look at our country info here. 450, again, just like the other place. And we've got a little bit more risk here because sea borders and 40% chance of spreading. Probably could spread to the United States too, which would be a huge problem once it gets to the United States. Not much by air. I'm worried about land borders mostly. And sea borders from Liberia. Alright, Argentina poses a high risk of infecting other countries. Argentina? Do they have an infection? Yes, they do. So Argentina is the biggest risk, it looks like. What do we got here? We have somebody in Paraguay. That is a specialist unit. Let's move our specialist unit into Argentina. And some of these countries have different provinces. I don't know if they all start in the same province. Or I don't know if it's throughout the entire country. Argentina poses high risk of infecting following countries: Brazil and Chile. Chile. They don't have any other warnings for high risks. Virus spread for land borders is 55. Sea borders is 40. 55 for air borders. We really got to shut down. Oh, and there you go. It has different regions too. I wonder if you could shut down a region. I don't know what our options are in Argentina. Land borders really need to get shut down immediately, but we do not have the ability to do so because the fear factor is not high enough. So, we're in trouble there. So, I think this game looks pretty fun. Are there any decrees I can do? You guys tell me what you think in the comments. I'm going to pause it here because I don't really know exactly what I'm doing, but the game looks like a lot of fun. I've been waiting for a game like this. I just, right from the beginning, as soon as this pandemic hit, I thought there would be a really interesting simulation just to try to, simulation game just to try to contain the pandemic. So, let me know what you guys think. In the comments, like the video if you want me to play. If I get 20 likes, I'll probably start a series. So, that's it for me today. Thanks for watching. Hope you guys all stay healthy and stay safe. See you guys in the next video.